ask that you participate, that you join in the discussion. If you need a bathroom break while we're going, just feel free to step out and come on back. And please feel free to use, click on this, I guess, okay. The chat box, if you have questions or comments, and John Pineda is gratefully, for me, I'm gratefully glad to have him here helping. And he's going to flag me then if there's any questions or something that I missed. But we're not that big of a group, so please feel free to speak up. And it probably helps to turn on your camera if you're going to be participating, so you're not this voice coming out of the black box. Whatever works for you. Another reason why I'm excited about doing this presentation is that at the end of the day, field instructors are what makes schools of social work work. I was at San Diego State almost 25 years, and about the last 4 of those, I was the director. And I was a field supervisor and worked closely with our field director, who some of you probably know, Amanda Lee. And also, I was involved with evaluations of the whole program that we would give to the BSW and MSW students. And guess who they always liked the best, or said was the most impactful, was their field instruction, their field instructor and their experiences in field. So without field instructors, most schools of social work just could not keep the ball rolling. So it's a wonderful thing how you give of your time and you give back to students. And I love seeing my former students come back and be field instructors in San Diego County. That was always just so meaningful and exciting to me. So is there some way you can go to the slideshow and make it just one slide at a time, John? Would that be easier?
I'm gonna try. I have 2 screens here, so let me see if I'm able to do it. Let me see.
Okay, if you can't, that's fine.
Are you able to see the screen?
Yeah.
Or no?
Yes.
Okay.
Yeah, so could you go to the next one, please?
Okay, there we go.
All right, thank you. So since we are a small group, we could probably go around very quickly. And I'm asking if you can give your name and where you work, the name of the agency or hospital or program or school, and talk a little bit about what you're seeing as some of the concerns that your interns bring to field instruction. Like what kinds of issues come up, and kind of what are the kinds of things that you work around motivating them toward? What is it you want them to do? So I kind of like to throw that out there, and if we could just go around and have everybody introduce themselves. Maybe we could take down the slide at this point so we have the full screen. John, are you able to do that?
You want me to take it off?
Is there any way you can like mute it or something so that we can see everybody, have the full gallery view, or not? There we go. Thank you. That's it. Okay. Who wants to start?
I can start. Good morning, everyone. Nice to see you all. Happy Friday. My name is Anita Takahashi. I'm a FSP clinical supervisor at MHALA K FSP program. We work with transition age youth, and some of the common problems that my intern brings up is just putting a lot on his plate. I really, he's so passionate about the field of social work, and it's so refreshing actually, but sometimes he puts so much on his plate that he sometimes forgets little details at times.
So taking on too many responsibilities or trying to do too much, something like that? Yeah. Okay, so what is it kind of you're trying to motivate them to do?
Just to, continue to problem solve, because, he brings, I feel like it's a two-way street where we're able to support him in his field work, but he's also bringing his own insight and own experience to support the agency as well. So he wants to, he's like a self-starter. He starts a macro project and he wants to help with providing the staff with information regarding some some housing opportunities that are more inclusive, so it's really, really great. But maybe motivating him to be able to problem solve, in a short period of time. What is he able to do or accomplish, or if he's able to work with, maybe the team and rely on the team, that way he doesn't take on everything all at once.
Okay. Thank you. Welcome. Who wants to go next?
I'll go ahead and go.
Hi, Jacqueline.
Hi, good morning, everyone. My name is Jacqueline Tapia. I am the field instructor for CityNet Homeless Services here in Orange County, specifically in the city of Anaheim. So one of the things, so we do a lot of outreach. So our interns that come in from your schools, they do a lot of community engagement. And I always notice that some of the challenges that my interns are having right now is wanting to know all the resources for our homeless residents. And I always tell them when I started and I was right out of my graduate program, is I went and started looking up all kinds of different resources because I wanted to know everything all at once. And I realized that that was not going to be very practical or efficient, because even though, yes, we do work with street level homelessness, everyone needs different resources. So not to be overwhelmed with not knowing a resource for every person that you encounter, but really taking it step by step and just really focusing not just on having an answer, but really just being able to establish a relationship and being able to build that rapport, and then being able to, look up a resource for that specific person. So I think that's one of the main challenges that I hear from my interns is we just want to know the resources out there. And lucky for them, our where we're interning right now is specifically just in one city. So I said with time, all that knowledge will start coming in, because you'll get a lot of that information from your preceptors as well as your other teammates. So don't get too don't get tunnel vision on just wanting to know every single resource in the city for your clients. That will come with time, with building a rapport and building that relationship with them. So that's kind of, the guidance that I give them, because I went through that as well, where I just wanted to know everything. I was like, yeah, it's probably not going to happen. It will happen with time, and you will be, let's just focus on, building your confidence and building that comfort of going out. This is not a normal internship placement where we're seeing clients here, clients are coming to the office, we're going out to them, we're going out in outreach, we're going into their encampments, we're going into their places where they call home. So I was like, just focus on being able to build that rapport and that communication, and the resources will flood in later on.
Thank you.
Yeah.
Who's next?
I'll go. I am also at CCRT with CityNet. So some of the challenges that I have seen with my intern is doing that initial introduction, because we are doing that street outreach. It can be a little intimidating to, go up to an encampment and say, hey, I'm with CityNet. This is what we do. What can we do for you today? So just a lot of encouraging and see what's making them feel that way, and then being supportive of them, saying, I got your back, I'm here, you're good, I got you.
So it's pretty intimidating going into the unknown like that. Yep. Thank you, Danielle. I'm taking notes on all of this too, by the way. So, okay. Who's next?
I could go next. Oh, sorry. I'll go after you. Go ahead.
Are you sure?
Yeah.
Oh, okay. Hi, I'm Margarita Calzadilla Kishimoto. I'm with Kaiser Permanente Orange County Behavioral Health. My current interns, I think what they got hung up on initially was, we're doing everything virtually. So then, of course, there's the electronic charting that we've been doing for a long time, but the forms have been so improved, quote, so improved, that there's a whole lot of drop down boxes, you know, to sort of make things easier for the therapist to move things along. And they, sweet boys that they are, they just read through all the symptoms, all the drop downs, and asking the patients if they're having any of these symptoms. And then when you look at the evaluation after they've done it, the patient looks like they've got all the symptoms in the world because they didn't think it out. You know, they're not. So we've had conversations, and how I've helped them motivate them is to talk about not getting lost in the content, and looking at the process and sort of asking them to not worry so much about the drop downs and sort of pay more attention to the story of the patient. And that would build rapport, because then of course their follow-up session is of course horrible if the patient even wanted to come back and see them, because that whole rapport thing didn't happen because they were too worried about the form. So it's been kind of interesting.
Yeah, I don't know if you've ever had MI training, but they call that the question answer trap.
What they were doing. And it sort of makes you feel like a bad field instructor, because it didn't occur to me that that's what they would do, because I had them shadow a bunch of people. And in theory, I hope that's not what's happening with the people they were shadowing, but now I'm going to have to go back and check, because I just don't. So it's interesting.
Thank you. Welcome. Who was next?
Okay, I'll jump in.
Tracy.
My name is Tracy Aaron. I am actually a preceptor. The field instructor that's working with our intern specifically, she's in court this morning, and we are with Orange County Healthcare Agency, and I supervise the DUI and drug court programs for the county, and we're also DMC certified, so we're required to have extensive MI training. So that's also why I'm on instead of my field instructor, because we've had a lot of hours. But anyways, our interns are great. We have 4. I'm not sure how many are from Cal State Fullerton specifically, but I think at least 2. And I think one of the things that I see, and this is just across the board with interns, is they sometimes are fearful to say what they don't know, and they want to present like that they do know more than they probably know. And so we kind of like work with slowing them down. We treat our internship definitely as a learning experience. It's a training and an educational internship. They're not extra staff. They're not extra employees. So, you know, kind of like reminding them what they're there for, and kind of just that slow down and like make sure that you're grasping. There's so many trainings that our interns have to go through because we're DMC certified. They have to become registered as an AOD counselor. And there's just a lot of just added county stuff that they're just now starting to provide services. So, but they're doing fantastic. I mean, they're just really doing fantastic. So I don't have any like concerns other than for them to watch their own expectations, that they should know it all.
Thank you. Welcome.
I can go next.
Okay, Melissa.
Hi, I'm Melissa Ramirez, and I am at St. Joseph Hospital in Orange. I think the biggest challenge we have with all interns is them being able to apply what they're learning in class into the real world. So the application process of theory, putting it into practice. I think they struggle a lot with that in the beginning, and their professional development. A lot of our interns come to us with no work history. They got their bachelor's, now they're getting their master's. There was no break in between. A lot of them don't know how to approach their supervisor. If the office is open, they just walk right in and sit down and wait for them without realizing maybe I shouldn't walk into an administrator's office without waiting for them. It's like small little details that they just don't know because they don't have the experience. So something we do a lot here at our during our internship, not only learning medical social work, but is teaching professional development. Every supervision, from the first meeting, what they're supposed to look like when they come to supervision, their presentation to administrators. I take them with me to meetings with administrators so that they get that experience of how do you talk to executives versus your peers. Just learning how to, if you're not going to be on time, how do you contact your supervisor to let them know you're going to be running late in a professional way. And so, and in the beginning, not all of them, some of them do have some experience, but in the beginning, they, they're all just so overwhelmed. They're in a hospital, they're learning a new language, they're learning how to deal with a whole bunch of things they've never even thought of before. And on top of that, learning to be real professional social workers. Because the one thing I tell them from day one is, you are on the tail end of this. You are getting ready to be a full-fledged social worker in 9 short months. And our job is to get you employed. And we can't do that if we don't just put the icing on the cake that the school has started. So that's kind of a little off spin of teaching them how to put theory into practice and get ready for the real workforce.
Okay, thank you.
I can go.
Laura.
Good morning, everyone. My name is Laura, and I am a field instructor at CHOC, so Children's Hospitals of Orange County. My intern is in the PICU, so our intensive care unit for our pediatric patients. So it's very intense unit, a fast-paced unit. In the PICU, we deal a lot with children who are end of life. We deal with children with chronic medical conditions, as well as we're a trauma center. So car accidents, falls, suicide attempts, so on and so forth. So I absolutely, the intern we have is fabulous. We have another one who's not on today, another field instructor in our NICU. But for the PICU, one of the things that we're working on is helping, her first internship was in a clinical setting. She has really strong clinical skills. When we talk about her cases, she is able to talk about her interventions, but a pattern is not documenting that in her notes. So working with her to help label the things that she's able to say verbally, to be able to document that in the medical record. That's an overall challenge zone medical social work overall. So she's responsive to, coming up with some key phrases about the clinical work that she's doing, providing empathetic support, active listening, things such as that. But she's absolutely wonderful. Thank you.
Great, thank you. It's a hard time you're working. It's a hard place too. Okay, who else? Crystal. I'm gonna call it since I see your face there.
Hello, everyone. My name is Crystal Lee, and I actually am not a field instructor. I am the program manager for another grant program called Allied Health Academy under Dr. Chanel. I'm really here just to observe. All of my interns currently are high school students. So it is a bit of a different kind of supervision experience, a lot of teaching, a lot of professional communication, development, things like that. I'm really here just because I'm really interested in motivational interviewing. So I'm just here to listen and learn.
Thank you so much. I'm glad you're here.
Hi, my name is Anne Wong. I am the field instructor, and also I'm a program director in our site. I am working with the Pacific Connects Asian Pacific Family Center in the city of Rosemead, Allen County. My student, she is working with our CareWorks team. I also have older adult team, things like that, but she works only with a CareWorks team. She is actually very enthusiastic to learn. The only thing that she needs to improve, of course, across the board is to improve more confidence. She is very concerned whether she's doing the right thing. I have a staff, a therapist for her to shadow. Hopefully she will gain more understanding of the whole process, and she will be less worried about whether she would do the right thing or not. She's actually very empathetic from the process recording I saw. But one thing that I identify is she's very tense whenever her client were upset or angry. So she told me that she is receiving counseling from school, so to deal with her countertransference. And so I think this is something that is good to improve her clinical
for her.
skills. Yeah, and another thing is the TELWOS clients are not that compliant. 50% of the intake is no-show. So she has to learn how to deal with all these no-show and not coming to see her, things like that. And she still need to build up her caseload. It is still slow. She has a lot of training because Pacific Clinics offer training almost every Wednesday, whole day training. So in the beginning, she felt overwhelmed with all this training.
It's a lot. Okay, thank you. Welcome. Angela, you go.
Same as Crystal, I am also not a field instructor. I'm just a graduate student working with the BHEAL team. Also just here to learn and to listen.
Okay.
Thank you.
Welcome. Who else do we have? Do we have Melissa?
Hi, I'm Donna. I can go.
Okay.
Hi, I'm Donna Armfield Hume. I'm at Providence St. Joseph's Hospital in Orange with Melissa. I'm on the inpatient behavioral health services unit. I currently have 5 interns for MSWs from all the different, from 4 different universities. Wow. So it's great to hear and see other field instructors and what they're doing and what they're experiencing, which we have a lot of similarities. We're an acute setting. Our average length of stay is 3 to 5 days. So it can be pretty intense. As far as motivating, most of the interns are really great at as far as being motivated. What I'm finding is for them is getting to the point, they're very, the positives is they're very strength-based, focused, and it's almost like sometimes they're almost too strength-based focused, both for the patient and for themselves, that they don't allow as much, they're getting there as far as allowing sharing their challenges or any negative feelings that they might be experiencing, as well as when I'm looking at some of their evaluations, it's like, okay, why is this patient even here? They look really well. So finding
really
that balance,
strengths-based, huh?
yeah, that it's okay to recognize and assess. So it's developing their clinical skills, and that it's okay for someone to have symptoms and it's not judging them that they're a bad person. So they're almost kind of, I'm a social worker, so I always have to be compassionate, understanding, and, this unconditional positive regard. And how can you still have that in addition to recognizing, pathology to do appropriate assessment and interventions? So that would probably be, part of our work in addition to all the other things that were mentioned.
Wow, that's very interesting. Thank you. Welcome.
You're welcome. Glad to be here.
Okay, who else do we have to go? I'm keeping a list, but have we heard from Jessica? There she is.
Hey there. Good morning, everyone. My name's Jessica. I work at CityNet along with Jackie and Danielle. I'm a preceptor, and I think I've noticed a few things. I think our department and the population that we work with it can be pretty intense. It's fast paced, and I think it has been challenging for the interns to dive right into everything regarding the data, building a level of confidence when they approach clients, and their own personal style. I think it's super important for the homeless population that we work with, to present, even if you don't really know what, resource is perfect for them, you have to really present that way so that they, you build that level of trust with them and they respect you out there. So I think I'm hoping in the next few weeks I see more of that and more just diving right in and taking kind of the lead, even though they're with, other case managers and experienced people in the field. I'd like to see that take more of a lead. So, but they're great. They're wonderful so far.
Thank you. Who else have?
I'll go next. I am actually a field liaison as well as the student field director here at Cal State Fullerton.
Oh, okay.
So some of this, like CityNet, Kaiser, Crittenton, St. Joseph. So I have some of your students in my class. And so it's great to see that dual perspective of what, the student is seeing that gaps in learning. And then with the field instructor reports, and then using motivational interviewing, which I love, by the way. We use your book in our MI class, our practice class, but helping the student make those connections. So I'm taking notes too. And it really helps us as the field liaisons make that gap, fill that gap.
Okay, thank you. Good to hear. Did we catch everybody?
I'll introduce myself really quickly. I am the other field director. I'm the partner in crime with Marcella. So I am Deborah Saxton. I'm the community field director, and I just want to say welcome to everybody. I see a lot of familiar faces, familiar names where I may never have seen you in person. So it's good to see everybody here, and excited to have you with us, Mindy. Thank you.
Thank you. Well, if we've gotten everybody, then maybe we can move on to the next slide. John, if that'd be okay. All right, and the next slide. So, kind of like this topic, how does motivational interviewing fit together with field instruction? And I was going to generate a conversation about what do you already know about MI and kind of what your thoughts are. I would say, just a show of hands, how many of you are familiar with MI or have heard a bit about it? Okay. So that's I kind of figured. Most people have been to some training or have heard something about it. Based on what you know about MI, how might it or why might it be helpful in field instruction? What are your thoughts about that?
Mindy, if I could jump in, I feel that we've used MI with clients, but it is different motivating students to move forward with the gaps in their learning. Like hearing from some of the field instructors, either they're trying so hard or they're not asking the right questions and they're nervous to do that, and having that motivation to bring that to supervision and to ask those questions. So it's using MI, but in a different perspective, working with a student than a client. I feel a bit of a different approach when I'm using it with the student. Not the skills, but I guess my approach.
And I think I would agree with you because for all the years that I was teaching MI at San Diego State, I was never a practicing clinician, but I certainly had students that would come to me, particularly when I was the director, with issues. And it would be partly to slow myself down and to see if this is a place where I can use MI. So, your student isn't your client. However, well, we'll kind of get to that. We still want to have motivating conversations. Other thoughts about what is it about MI that might be helpful in field instruction?
This is Tracy. I provide clinical supervision to a number of my clinical staff. And I have talked a lot with the interns that I have on our site. And I really love to utilize MI. I think MI is one of those things that we're doing it when we don't even know we're doing it. Because even when I interview people and I ask them what EVPs they know, they talk about things, but they don't identify MI by saying MI. And then all of a sudden it's like, hey, you're using MI. I think one, it role models to our interns and our clinical staff the use of MI. And it allows really a free flowing conversation that actually ends up kind of looking into things, whether you're discussing countertransference, maybe fear of working with certain clients. It opens up kind of like a discussion around viewpoints. And so I find it very useful. And I think from what everyone shared, I mean, they're pretty demanding internship sites, and they are not necessarily working with the easiest populations, right? And so, I mean, we're working with substance abuse, homelessness, medical settings. You know, they're pretty serious situations, very different from where I did my internship many moons ago. And I think, you know, kind of providing that support to our school interns is super important, and MI is a great way to offer that.
Okay, thank you. Okay, why don't we go on to the next slide then? I'm just being mindful of time here a little bit too. So interestingly enough, there's nothing written on MI in field instruction in social work. There's a few things written that I reference here that come more from the counseling, marriage, family therapy, counseling field. So this is what I was able to, actually there's a couple things written about, I take that back, about MI and social work. Not too much, but a little bit. As you know, and based on my reading with these articles, that the supervision process is used to develop a professional identity, some of the things you talked about, values and skills. In many ways, you know, we're talking about how we socialize someone into the social work profession, which is part of it. And I think a thread that kind of went through a lot of what you talked about is the anxiety that students have and how they cope with that anxiety, whether it's to try to know everything or to have, you know, act like you know everything, or as a way to kind of manage that anxiety. So being in field in general is anxiety producing, and then having to meet with your field instructor can be very anxiety producing. And probably all of you remember going to graduate school about how there is this loss of autonomy that even particularly if you had been out working and had been recognized as a professional, it's still a little loss of autonomy to go back and be under someone's supervision, or to be in a whole different field and just like, I don't know how to talk to people who are homeless, you know, like that whole lack of confidence. And I think those were some of the threads that went through what you were talking about. And those of you that are familiar with MI and the MI spirit, that MI can help create safety without fear of judgment. So, probably most of you are that way, that you're trying to allay their fears and their worries about being judged. And there's ways to do that within MI, as well as the other piece of it is that you're modeling the skills. And I think that's the piece that we're going to keep coming back to, is how when you use MI, you're modeling the skills to your intern. And MI in many is also seen as a communication method. It can be a therapy, but in many ways it's a communication method, and it's broadly taught to physicians, to probation officers, to physical therapists. It's just gone off crazy about the uptake of this counseling method, or not counseling method, but communication method. So it can be a counseling method, but it can also be considered something that can be done briefly and as a communication method. So when we think about the interns or students, when I was working as an educator, not being our clients per se, but we still have to communicate with them. And we want to do so in the way that's the most helpful. And so MI using MI in field instruction can become what's called a parallel process. And there is other research written about using MI as a coaching skill to coach people in how to use MI. And very much they call this a parallel process. So it's almost like you're getting a twofer when you use MI in field instruction, because you're demonstrating it to the client or to the student, they're feeling it, they're experiencing it, and then we'll look at in the next week's session about how do you have what's called a meta conversation. And I adopted that term long before Mark Zuckerberg brought it out last week about meta. But anyway, the meta conversation is a conversation about a conversation. So how do you step back then, and we'll practice that next week, and then talk about what just happened during our meeting, during our field instruction time. So next slide, please. And please feel free, let's see, I'm seeing the chat box here if there's a question. Okay, that was from David. So just a little bit, we're going to review a little bit of MI, and we're going to go into our next breakout, our first breakout room, just so you can practice your skills with one other person. And then we'll come back and talk about some of the concepts and the skills of MI, just to kind of go through what it is. Then we'll have a demonstration. I'll do a demonstration if one of you would be a volunteer as a student. And then we'll go into a second breakout room. So can we go to the next slide, please? So for your first breakout room here, this is an exercise, and you might have done it before at MI training. It's kind of a classic, but it's to work in pairs, and you think of and we call it a real play, that it's not a role play, but you're thinking about yourself. What's a behavior or issue, something that you feel two ways about, or something you might need to change? And, you know, we want to make it not trivial like the color of your hair, but not so serious like a divorce, somewhere in between, like about diet, exercise. A lot of times students would talk about procrastination, studying habits for them. So think about something that you might want to change. And when you get into your breakout room, one of you volunteer to be the client and the other the social worker. And I'm going to give you a script that I ask you to follow. And John is going to put it in the chat box because we'll lose the slide. But to make this work, we ask that you follow the script exactly, and you'll have 10 minutes. So when you start out, decide who's going to be the social worker, who's going to be the client, and then client say, this is my issue. This is what I want to talk about. Questions about this? Okay, next slide. So here is your script. And as you can see, John's pasted it, thank you, in the text box. Then go ahead and ask, why would you want to make this change? How might you go about it in order to succeed? What are the 3 best reasons to do it? Summarize what you've heard, give a nice big summary, and then ask, what will you do next? Questions? Okay, you'll have 10 minutes. So John, if you go ahead and assign the breakout rooms. Think everybody.
Yep. So let me just pause.
Okay, is everybody back? Everybody back, John? Okay, good. Just to get some feedback from you about what happened during this and what you experienced. For those of you that were the client, I didn't tell you necessarily that you had a switch because we really don't have much time. What was it like to be the client?
I can go. I was actually the client because I'm normally not the client for some reason, so I wanted to switch it around. But it felt nice because I get to hear my thoughts out loud, and someone was listening to me.
Mm-hmm. What was it about hearing your thoughts out loud?
Just the summarizing piece helped what I was able to do, and it helped to regarding self-efficacy, like, oh, I did it before in the past. This is what I did. Or, you know, these are the reasons why, the best reasons why I want to make the change.
Okay. Yeah, there's something very powerful about a good summary that pulls everything together. And in MI, Bill Miller is the developer of it, uses and Steve Rolnick, they use the metaphors that you're handing the client a bouquet of flowers, like you're pulling all these different flowers together and you're handing it back to them. Like, so this is kind of the thing you're talking about. Okay. What else was it like to be the client?
I appreciated being the client. Similar to the last year, it's kind of nice to like put out there something that you're working on, and the person that I was in the group with, like, she was so responsive, even though she was following the script. It allowed like such an easy, natural flow. For me, because I mean, it's a real life thing that I shared about. I think everyone did, being the client, and it just was a nice little 10 minutes of like reflecting on something that I'm working on and where I struggle. And yeah, it was cool.
Okay, thank you. What was it like to be the social worker? Other than social workers don't like being given scripts, told what to say. But what was it like?
I'll share. I found it really helpful. It kind of gave me, because it was really, particularly in thinking about field placement, it's really easy to get off on tangents and to go down different paths, but this just really kept it, it really, focusing in on the particular, what she was sharing, and actually not worrying about having to respond to each of whatever she was sharing. It was just like, okay, just listening, taking it all in, and then what might be the next step, and why you might want to do this. And just found myself using more reflective listening. So it was, I found it very helpful.
Okay. Gave you a framework to work from. Good.
Yeah.
And okay. What skills did you see used, or did you use? What happened? This is kind of a meta conversation. What skills did you see used?
One of the things I love about MI is that it gives you the names of those skills. So like really after every patient that I see, and which is in the PICU, it's really, I'm working with families and primarily parents with the pandemic. So I always at the end of my meetings will say, okay, so I'll work on blankety blank and I'll provide blankety blank. And so it sounds like you're going to work on da da da. And then but MI actually is like, it's summarizing. And so same thing when I'm talking to a parent and I'm saying that, I really appreciate how they're asking questions to the doctors. That's affirming. So I really appreciate MI's labeling what I sort of have developed my own skill set through the years, but MI does such a beautiful job labeling those clinical skills.
And recognizing their importance. Yeah. So what's your takeaway from this exercise, if anything?
I want to use it more with my intern.
Who else? What is your takeaway from this?
The meta conversation and recognizing that parallel process.
Okay. And what we'll talk about next week is, I think we got to name it as a meta conversation. Students might or might not recognize it unless you're telling them this is what we're doing, as we will talk about, or what did you see happen, to be able to process it, because as a teaching skill tool to be able to go back and talk about it. Okay. One other takeaway from the exercise, or response or comment, whatever feedback you want to give about it. No, nobody? Okay,
I
well,
will-
go
I was
ahead.
just gonna say, Mindy, that it just, I feel like it naturally, like I said before, opens up lines of communication. And, you know, like, I think that with our interns, it's important to recognize how much more they have going on in their life than just the internship. And when we can have a kind of this conversation with, like Laura and I, you know, Laura was the clinician and I was the client, but it just was like a natural conversation about real life things. And I think it's important to have those conversations about real life things with our interns too, to see like what could be going on. Not that we're their therapist, but how easy it is for something in personal life to affect professional life or that day working with a client or things like that. So it's just, there's so much value in it.
Wong made a comment about, not sure if it's a parallel process, as some clients are not that insightful to change. Kay, what I'm talking about as a parallel process is more the field instruction. So you'd have students that should have some knowledge as to what these skills are and kind of what you're doing. I don't know. There is a scale, and probably some of you have seen some of these, that you give clients. You can ask them afterwards to fill out, that says like, my social worker listened to me and my social worker, you know, the opposite direction, told me what to do. But in terms of having actual insight into what is MI, it would have to be more with a student who has learned some of it and that you're discussing it with them. So can we go to the next slide then? And I'm just gonna, John, I'm gonna zip through these real quick because we're running out of time. But this is a definition of MI, that it's a collaborative, goal-oriented style of communication with a particular attention to the language of change. And it is designed to strengthen personal motivation and commitment for a specific goal by listening and exploring the person's own reasons for change and an atmosphere of acceptance and compassion. So we talk about how it's very collaborative, that the client or the student themselves come up with what the goal is or what you want to talk about. And we'll look at next week about what if you have something you want to talk about, how do you introduce that? But it's looking at what do they know about something already, and how are they, what are their goals and what are their methods of changing. So the next slide, please. And it's done under the MI spirit, which most of you have studied already, about having working in a partnership where you have an acceptance of the person, compassion for like kind of what you, I think, was it Tracy just said, somebody said about understanding, you know, maybe the whole of our students' lives and thinking about their best interest. And then the focus on evocation, that they're the ones doing all the talking, and have some of the insight and the expertise to apply what you're talking about. Next slide, and then the next slide. Next one, please. We're going to move on a little bit. And in MI, we talk about having 4 processes. So you have an engaging process where you're engaging with the client or the student, focusing about what are we going to talk about, evoking, asking questions, listening for what's called change talk in MI, and then planning, like how are you going to move forward. So next slide, please. I hate moving this fast. Most of you have heard of engaging skills as ORS, the open-ended questions, affirmations, a lot of reflective listenings, and then summary. And you use engaging skills throughout all the 4 processes. And Miller talks about, they show it as a staircase like I had there, because clients, it's not necessarily linear, that clients can walk up and down that staircase. They may change their focus, or they may not be as engaged if something happens within the relationship, or they may decide not to plan on anything. So let's go to the next slide, please. So the focusing stage, and this would be something like a handout that when we're doing MI with clients, that you can give them a client, something like this that they can circle. But I wanted to come up with some ideas around what a student might be wanting to talk about. And these were some of the things that you already, you know, brought up and stuff. A lot of about managing the workload, confidence to do the job. How do I use a specific treatment model? Working with mandated clients, or how do I approach clients, and dealing with clients' trauma. And those are just some ideas. When you have this as a handout, it's nice just to give to the person so they can, you could have more on there, at least start to circle it, or, you know, it's just another way of visually thinking about what the issues are, what they might want to talk about. And then the next stage, was there a question or comment? The next stage or process is then evoking, you know, talking about why is this an issue for you? What are your concerns about it? How have you tried to address it? You know, really getting the student to talk about their perspective on what they brought up as an issue, and then having them talk about it. And of course, you used open-ended questions and a lot of reflections. Some affirmations are like salt. They should be used very sparingly, and then perhaps bring it all together with a summary. So then let's move forward, I think, to, and change talk is the key to MI that makes it a little different from just doing reflective listening and excuse me, going along with the client. You're listening for and highlighting by reflecting it back, what it is they want to change, or their ability to do it, their reasons for change, or their need to change. And again, that you have to have a focus in an MI interview to be able to reflect the change talk. So if a student says, I might, let's see if I have some examples here. No, not today, that's next week. You know, I really want to be more professional. Okay, they're giving you some change talk. Tell me more about that. What is it about being professional? What would that look like for you? Or I think I could manage my anxiety around meeting new clients. How is that going to happen for you? How are you going to do that? What would that look like? Why is that important to you? The reasons for change, to be a little more confident in your interactions. So can we go to the next slide? Next slide. Planning, again, which kind of what you brought to, but clients and students may not know what they're going to do next, when they're going to do it, or how do you know if your plan is working. But you can at least ask them, where do you think you go from here? What's next? Okay, next slide. So I think it might be better just to do a demonstration of it where I will be the field instructor. And again, this is your bailiwick of work, so I may say things that wouldn't necessarily be totally accurate in terms of the job, but I would need somebody to do a role play with me as to be an intern, and I will be the field instructor, and we'll see how we put some of this MI in place. So is anybody willing to, and then maybe John, we could go to the 2 slides. I don't know how, I mean the 2 boxes, how that works. Okay, now go back. Okay. So anybody want to be a volunteer with me? Role play one of your students? I just ask that you don't make it a miserable person.
Well, I may regret it, but I could do it.
Good for you, Margarita. Thank you.
Sure.
Okay.
I hope
All
I'm
right.
scoring brownie points with the staff over there.
Where is it again that you work?
I work for Kaiser.
Kaiser. Okay. And
Yes.
medical?
Behavioral health, outpatient.
Behavioral health. Okay.
Yeah.
Okay. My background was I worked in substance use treatment and did a lot of research actually at our DUI that we had in San Diego. So mental health is, well, anyway. Okay. I can think of an issue that a student might have, okay?
Oh, I got it. All right.
Okay. All right. So what I'm going to try to do is walk you through engaging, focusing, evoking, and then planning. We have about 10 minutes.
Okay.
All right. Hey, Margarita, how you doing today?
Good. Mindy, how are you?
Okay. Okay. I'm glad it's Friday.
Me too.
Yeah. Okay.
It's been a long week.
It's been a real long week. Yeah. Things have been very hectic. How else has it been going for you?
Well, I think it's just been really hard. I'm having a struggle with trying to get it done. The work here, the charting, the schoolwork, and then the weekly process recordings. It's just a lot. It's just a lot.
You got a lot on your plate. So not only here, it's the process recording and as well as actual meeting with clients and figuring that out. And also it's school and homework and demands of school and probably family stuff too you got going on.
Yeah.
Yeah, it's a lot. How would you like to use our time as we meet together today? What, if anything, out of that list or anything else would you like to talk about?
It's mostly that I'm just really overwhelmed. I don't see how I can get it all done.
So around, what's the best way to strategize your use of your time?
Yeah, it just takes a long time. Yeah, it just takes a long time to do those process recordings and the charting.
Okay. So would that be your focus more around talking about that specific task, or would it be more just in general getting everything done?
Probably getting that done because it just seems like a lot to do.
Okay. All right. So the charting and the process recording. Okay. So tell me a little bit about your experience with that.
It just takes a really long time. Like with the process recording, it just takes a really long time to do a verbatim, of the whole session like you asked.
Okay. So thinking about the session and what happened in that session and trying to get the conversation right. Yeah. So that is hard because you have to have a memory like a steel trap to be able to get that conversation right. Okay.
Well, it just takes so much time, and there's just so much other stuff I'm trying to do with school and my the charting and the school stuff, the papers. It's just a lot to do those every week.
Okay. So a lot to accomplish. When you do the process recording, what if anything has been helpful to you to get that done?
Well, taking some better notes has been helpful to help remember the session.
Okay. So taking notes. Okay. So when you go back to your notes, it kind of is like, oh yeah, we talked about that. Okay. What else has been helpful that's worked for you in terms of getting it done?
Well, I don't know if it's helpful. I've just been sort of forcing myself to do it.
Like giving yourself a deadline.
Yeah.
Okay. So you're taking notes and you're giving yourself a deadline, and but I'm wondering, or I'm thinking that maybe you're kind of questioning, like, what's the whole purpose of this? Like, it just seems like busy work.
Yeah, it just seems like a lot.
Yeah, and you're not really getting a whole lot out of it.
Well, it's only my second one. So
Pardon?
I said it's only my second one. But,
Okay, okay,
yeah, so it's kind of, I don't know, but it just seems like a lot of work.
okay, yeah. And so it's a lot of work without much payoff.
Yeah, I mean, I just don't know why I have to do the whole session or why it has to be so detailed. Why couldn't I do just a summary?
Uh-huh, okay. So that's pretty confusing about why this big, long, okay.
Mhm.
What are your thoughts on that? Or what do you know about process recordings?
Well, they just seem a little tedious.
Mm-hmm.
With the charting on top of that, sort of feels like and then if we've talked about it, then it seems like it's a little bit repetitive.
Mm-hmm. So it's like you're double working.
Mm-hmm.
Yeah. So the charting is pretty much the same as the process recording in terms of your kind of the things that you're noting.
Yeah, it just takes a long time.
Mm-hmm. Yeah. Yeah. What? Tell me, if any, what were the benefits of doing the process recording? Any good things that came out of it?
Well, yeah, I mean, I think that the first one I gave you gave me a lot of feedback, and there was a lot of stuff that made me think about stuff in it, about how that session could have gone a little bit differently or how I could have asked the questions differently.
Mm-hmm. Okay. So the feedback was helpful.
Yeah.
Okay. Okay. Because sometimes feedback becomes hard too.
Yeah.
Yeah. Okay. So what were you doing differently then once you got a little feedback?
Maybe the schoolwork started to kick in. Those those teachers at Fullerton, they give a lot of homework.
Mm-hmm, they do. They do. Okay. Wait, in terms of the process recording, you got some feedback, and some of it was like, why is she telling me this? And the other part was, well, it was kind of helpful, and I'm not sure what you used in that.
Yeah, I think that, I think that it's not that it's not helpful and that I didn't get a lot of good information out of it. It's just trying to find enough time. Maybe I need some time during my day while I'm here to start writing it or something.
Okay. Okay. So that's kind of the issue is finding your time to do that. What other ideas about finding time do you have?
I don't know. I guess I could make sure that I have some, maybe we could talk about making some time protected or somehow so that I could just work on that while I'm here.
So to take some of your scheduled time and say, Margarita, this is your process recording time.
Right.
Okay. All right. What other ideas do you have about what might help you?
Well, perfect world not to do them at all, but
yeah.
Well, I hope that I won't have to do them verbatim or every week forever.
Okay. So if you see some light at the end of the tunnel, that this isn't an extended assignment.
Right.
Okay. Okay. Other ideas you have about managing your time and getting this done?
Well, I think if I can't do it at the office, then maybe, that's one of the things that I should probably do at home too. Like I do homework, just make time for that too, like schedule it or something.
Okay. So schedule that as part of your homework.
Mm-hmm.
Okay. All right. Well, let me see if I got everything here, and I appreciate your being honest and kind of tell me what's going on with your struggle, because it certainly sounds like you have a lot on your plate, but just getting this blooming process recording done. And and you wonder about some of the value in doing it when you're already charting. And on the other hand, you know, we were able to look at it and get some feedback and maybe try something different. Okay. And so one of your thoughts was that perhaps we could look at your schedule and try to schedule it in here so you would have dedicated time for that. And also to perhaps to maybe look at dedicated time in your schedule when you're not here, so that you know, like it's kind of like your homework and you get it done and quit having it hanging over your head.
Right.
Okay. Yeah. Okay. So where do we go from here?
Well, I guess we just have to figure out what time that would be, when that could happen.
Okay. Okay. How much time do you think you would need?
Well, probably to get a good start on it, probably an hour, I would think. I might need an hour at home, I think, because they're taking a long time. Right now,
Okay.
they're taking a long time.
Yeah. Yeah. Okay. And so you're kind of thinking that the more you do it, the easier they're going to get, even though you don't want to do more. But anyway.
Yeah. Well, you know, I'm waiting for you to, you know, let me off the hook of doing the whole session and just doing part of the session. So.
Okay. Okay. So it'd be a lot easier if it was just kind of pared down, even though how do you know, like what might be missed or what?
Right.
Yeah. Okay. All right. Well, let me get back to you about the schedule here. And if you could think about where to put it in your own schedule at home or when you're on campus or that kind of thing. And we can talk about it some more next week.
Perfect. Great. That'd be really helpful.
Okay. Okay. Thank you. And thank you, Margarita, for going out on a limb.
No worries. Hope I wasn't
Okay.
being difficult. I wasn't trying to be.
Okay. What? Oh, you were.
Well, let me tell you, my student was too.
Yeah.
Yes.
Yeah. You know, and my thought was, does this person have a learning disability? We're writing anything? No, really, because, you know, for somebody to put stuff in writing can just be agony.
Yeah.
And if they're, but anyway, oh, thank you for the nice affirmation. Somebody said, thank you for the demonstration. And we'll see if we have time here to get to having another breakout, but I kind of wanted to process some of this, like what it was like for you to be the client, and then what other people saw that either seemed to work or maybe you'd suggest something different. So start with Margarita. What was it like for you to be the client?
Well, you know, you always feel a little bit on the spot, you know, especially when you're in front of your colleagues. But having had this exact conversation with a student and actually not easily resolved, I struggled with it because I thought, well, now I know how he felt having to do this with me, because I think he really wanted a solution that I wasn't willing to give him quite yet. And that was a struggle. I actually, in reflection, I don't know really how well that worked out. You know, we sort of ultimately sort of just agreed to do it my way. But I think, honestly, I'm just being transparent. It would have been nice to have been able to do more MI with him, to sort of get more of his sort of feel for what the challenge was. And, you know, could we find a solution for it? And I didn't ask him that. So I think we could have done that a little bit differently.
Yeah, that if we had had more time, like what's the issue? Like, is English a second language? Is there a learning disability? Like what's going on here?
All I heard was there was too much work. And honestly, I had a little bit of issue with it because I'm like, well, you're in grad school. You knew it was going to be a hard work. That was my first, and then I had to rein it in. But I honestly struggled with it. So I don't think that's why the session went as hard as it did.
I found you hard. That was hard.
He was hard.
Yeah, because you had a lot of sustained talk about how it was too hard, it was too much, it was stupid, it wasn't, There was no purpose to it. Like that was hard. And in MI, we don't want to focus on that sustained talk because like you talked about, somebody said earlier on in the other breakout room, you're hearing yourself talk. So the more your client or your student hears sustained talk about can't, won't, shouldn't, dumb, won't work, that kind of thing, then they're reinforcing that message. Okay. How about some feedback? What did you see? What struck you?
You asked the group, right? Not me, right?
Right. Yeah, the rest of our audience.
Okay, good.
Where is everybody?
I could hear the struggle that Margarita was going through, and I really appreciate your candidness and your transparency, Margarita, because we've been doing this for how long or whatever. And we kind of have our way of doing things and fitting our students when we're mindful that we're also developing them professionally, right? And depending on their practice setting, and documentation is part of our worlds now. So yeah, I really heard that struggle. But the other thing was, Mindy, you just hanging in, it was like, it's like, okay, you just hanging in there with the MI track, because it would be really easy to just like cut in and it's like, okay, let's solve this, rather than allowing the process to unfold and allowing the student to really be more a part and collaborate, right, with the solution rather than fixing it for them.
And even then I struggled with it.
Yeah.
I wanted to fix it for her.
Oh yeah.
But I wanted her to come up with a solution, because who knows, like I said, if it's a learning disability, whatever solution I have might not even touch that, or if it's having a child with some kind of disability at home that they need, like there's so many different reasons. And if we had had more time, perhaps we could come up with that. Or maybe students just not having any space at home to write. Yeah. Other comments, feedback, takeaway?
I really appreciated your compassion. And I also really appreciated taking those little small bits when she was having change talk, which was limited. What could be good about process recordings? What benefit could there be in that? So really tapping into those, the change talk, because Margarita, you were tough. But anyway, that's what I appreciated and learned.
Thank you. Okay, I'm looking at the chat box here. Didn't rush her, even though I'm very mindful of the clock here now. Okay. Didn't let her get stuck in hearing her sustained talk. Yeah. And sometimes people say, well, is it a little manipulative or stuff? If I'm trying to ask her, like, well, what are the benefits? Like I'm trying to sell her, like process recordings are a good thing.
I really thought, Mindy, that what I said in the chat is true, is that hearing myself out loud, sort of playing my student's role side of it, I realized sort of all the places where I could have done it differently, how I could have asked. That whole idea of asking, what can you do? How do we get through this? What can we do instead? What is right? I mean, that would have been helpful if I had been able to ask him those things to see what was his deal, because what I heard only, or what I felt only, was that somehow he wanted to get out of it, or wanted to do less or something. if I had been able to stay in the MI mindset, and sort of continue to engage and ask the things I needed to ask, I would have probably got a lot farther with it than I had. Because he's a very pleasant student. I really like him a lot, but I just couldn't understand it. And I think that I don't know if for any of you guys, but definitely my stuff came through a little bit, so my reaction to it was a little bit, people who know me know this about me. I was like, well, what the hell? It's graduate school. Of course it's going to be hard. What do you ask? What do you ask?
I had to do it.
Yeah. Basically I had to do it. So what are you asking me? Right. What are you asking me? And I think I should have asked that. Maybe I should have asked, what are you asking me that you need? And I didn't.
So thinking about how we had this conversation, the next time you meet with him, what might you do differently?
Yeah, I think I might back the train up and ask some questions. He's going to be about to be happy because he's going to just do parts of the session now and not the whole thing, but because he's been doing fine. But I think I'll have to ask him what maybe a little bit about what he was hoping to get out of the conversation, or what did he hope that I would do for him, or what did he expect, just so I could kind of understand, because I don't think this is the last thing that'll come up probably.
Okay. So what I just did was an example of the meta conversation. So we had the conversation about the conversation, and then thinking how it affected you, and how might you then in turn apply it to your client, which is the intern. Good job, Marguerite. You let me get that in.
Glad I could be helpful.
So, because I had wanted to do another taste of MI, but in a field setting. So what we can do is perhaps, and I'm being mindful of time, but start on that next week. So you can have some of the practice, but let's see, John, could we go to well, anyway, just so that you can see this, if you need a little script for the next week, think about, and then go along to the next one, or the next slide, please. So when you go, if you're going to work with an intern this week, I kind of like to ask that you think about, how am I engaging them? And usually it can be a little chit chat. It's usually more than chit chat, but setting the stage. And you don't probably need to spend a lot of time in engaging them, because you're already working with them. You already have a relationship. Focus. What would you like to talk about today? And then reflect as much as you can. So in MI, we talk about, good MI has 2 to 3 reflections for every question. So you're not getting into that question answer trap. And then if there's a place to affirm the intern, and then kind of summarize and bring it together. So, I kind of like to throw it out there that if you spend some time with your student, you don't need to get into the meta conversation and then taking a step back and saying, okay, what did you learn by what I just did? And that kind of thing. That's for next week. Does this look like something you might be willing or able to try in the next week? Okay, any questions or comments on it?
Yes, I will do it. This is my plan.
That's commitment talk.
Yes.
I will do it. And it's just a rough draft of how it might go. And I'll be anxious for your feedback too about maybe I should have, could use a little more of this or that.
Yeah, that'd be great. Thank you.
Next slide. Thank you. Next slide, please. We kind of debrief, well, if you were going to do it, if we had enough time, about, again, what were the skills and what was your takeaway. But just from today, what's your takeaway from today, and how might you use MI over the next week? We already got one commitment statement. But the
I can
takeaway
try
doesn't
to,
have to be-
I can go. Oh, do you want to go? Go ahead.
well, I can definitely try to probably summarize more and, you know, ask more of that open-ended question so that, you know, the student don't get stuck in the sustained talk.
Yeah. I said at MI training once, and the guy, I remember this guy saying it, he says, the two most important words I ever learned from Bill Miller were what else? Or why else? Like you keep pulling out, you know, what might be the benefit of doing a process recording? What else might be the benefit? You kind of keep pulling it out so they're hearing themselves talk about benefits or reasons, you know, change talk.
So and at Chalk, what we do with our interns is the first semester they work with their field instructor, but the second semester they have preceptors on different medical units. So my question, because now my time with her in terms of working with her so closely will come to an end, you know, in a month or two, in 2 months. So I'd like to ask her, what else does she want to learn while she's in the PICU? What other things would she like to work more closely with me while we continue to work this closely together? And what does she hope for before I sort of send her off to the other preceptors at the hospital?
Well, that's great. She may surprise you. She may come up with what you think, or I'll be curious if she comes up with something like you kind of go, oh, that's new, or that's different. Yeah. Wonderful. Any other takeaways or comments or commitment for what you're going to do this next week? And we come back and talk about it next week. I'm not sure if you have access to the whole slide set, do they, John or Dr. Chanel?
Not yet. I could attach it right now after this.
Okay.
Yeah. Both of them. I'll put both of them.
Thank you, because I know it has information on it that I kind of zipped right through it. So if you want to, there they are. Okay, well, we have about 10 minutes. I think we can finish up a little bit early, and because we don't have enough time to do our second breakout room, but I appreciated Margarita jumping in and doing the demonstration. And there are, if you go back to the slide before, if any of you want these articles, I can send them to you. And then if you go to the next slide, there's my email address if you want to email me, but if you're interested in that. And these were just some of the motivational interviewing books that I thought might be most pertinent to some of your work. The motivational interviewing, helping people change one, where the arrow is, that's the Bible one, that Bill Miller's book. So, okay. So you're going to be emailing the slides. Thank you. Any other questions or comments or?
I think real quick, you know, I'm thinking about it as a field liaison sign, hearing the conversation with you and Margarita, but I think as a field liaison, when the student comes and says, you know, I'm overwhelmed with the process recording, you know, still using that same conversation of, you know, what do you feel the obstacles are, using the open-ended questions and seeing, you know, what's preventing them, what do they feel the use of the process recording? Because Margarita, you bringing that up is a conversation I feel like I have with so many students, and I feel like I want to take that to just the whole class about, because we do on our syllabus about the process recordings, but that is a great technique to use as far as the obstacles they have with the process recording, because it's been around for all of us as a fantastic learning tool.
Yeah.
Hear that from them. What do they get from the process recording?
Right.
Use that. And I'm gonna I did in that what you said as far as what else, keep going, don't stop there.
Mine, yeah. And part of the problem is when you're, no matter what, if you're discussing barriers with clients or students, that gets you into a lot of sustained talk. So you kind of have to figure out how much do I need to know,
Right.
and when do I leave it go? Like, because you don't want them to be going, oh, it's too hard, it's too this, and so you can figure it out. That's kind of the art of MI, like hearing the ambivalence, but when to shut it down, so they're not just getting overwhelmed with it.
Exactly.
Okay.
Thank you.
Yeah, I think it would have helped me move along in my conversation with him if I had been thinking about that versus where I went, which I've already been transparent about. I sort of had my knee jerk, and that sort of really blocked me from doing what I needed with him to really kind of figure out what the issue was and see if there was anything that, he could come up with, that we could come up to, even we could come up together to resolve. I don't, because I don't hide, I don't know how supportive I was of him really in that process. At the end of the day, now he seems good with me, but I wonder, right? And so I think that probably when I see him next week, we'll have to have a little chat about what can we do, how is this working for him, and is there something else, right? I'm going to try to stay focused on that, but I want to hear how that is for him, because maybe I missed the boat a little bit there.
Probably not as much as you think you did, but
oh no, probably not, because I do pour my heart and soul into those darn process recordings, so I know he's getting a lot out of it, but I think allowing him that space to maybe for me to be a bit more supportive, to at least to understand, might be helpful.
Well, thank you so much, Margarita, for volunteering, because that was helpful. Thank you for being vulnerable, because it really got me thinking about how important it is for me to really be self-reflective, especially before coming into, the office of supervision. Just, okay, where am I at? So it's helpful. My own stuff can come out too. So I had to pause and, but yeah, thank you.
Somebody wrote, or Laura wrote, will the articles be sent, or we should email you directly? Should I just send them to Dr. Chanot or to John? Would that be? Okay. One of them, and I'd have to look at which one it is. It's interesting, but it's not like the best example of MI when they give the dialogue. So be curious to see your take on that, to look at that and kind of go, but it got published. Okay. So who should I send the articles to? Who has?
Can you send them to both of us, or just, I know you have my email address.
Okay.
Just send them to me. I'll take care.
Okay. And I was saying earlier, this physician just released some MI videos around using MI in mental health that are very good. So I can send those along. I mean, it's more for clients, not for students. We're like making new territory here, talking about students and student issues, and and even just like the whole concept, kind of almost, Margarita, what you're saying, like, and I could feel it for myself, like the powder transference issue is like, oh, I had to do this too. Like, come on, so you have to, yeah. Okay. All righty. Well, thank you all. And I look forward to seeing you next week. I hope you have a nice weekend. And the sun is coming out in South Orange County here. So hopefully that bodes well for all of us. So any last questions, comments?
Thank you.
Okay, thank you.